In Colombia, a 5-year-old boy inhales about 5 grams of naphthalene, and few days later, the 5-year-old boy is still alive, is still excited. How is it that this boy survived? What happened in this boy's body that enabled the sudden rise in pH to de-escalate so quickly? Well, I find it so interesting. Watch to the end of this video to find out why. Now, I've discovered that the body is like this mastermind that has the ability to resolve even what looks like the most unresolvable situations. And this mastermind is known as the compensatory mechanism of the body. How the body compensates for sudden increase in hydrogen concentration or sudden decline in bicarbonate concentration is by three major mechanisms. The first one is the buffer mechanism. The second one is the respiratory system, and the third one is the renal system. Each of these occurs in increasing as time goes on. The first one that will happen is the buffer within few seconds, within few minutes. Then the respiratory system goes in 30 minutes later, 20 minutes later. Then after 2 days, the renal system comes in. Let me explain. Remember that we said that when there is metabolic acidosis, there is an increase in acidic waste product of metabolism. Now, remember that I said that the first compensatory mechanism is the buffer system. Now, we are going to use the bicarbonate buffer. It is the most important buffer system in the body. To understand how this buffer system works, you have to understand what happens in the tissues and what happens in the lungs. Now, in the tissues, remember that when there is an accumulation of acids in the blood, let's there is an increase in when there's an increase in acid in the blood, the body forms hydrogen ions. There will be an increase in hydrogen ions because the acids will dissociate. Now, when there is an increase in hydrogen ions in the tissues, that hydrogen ion is buffered by hemoglobin. That hydrogen ion binds with hemoglobin. When it binds with hemoglobin in the red blood cell, the red blood cell then releases bicarbonate outside. When it binds with hemoglobin, then the red blood cell releases bicarbonate into the plasma. And when it releases bicarbonate into the plasma, it is carried by the plasma. Because there is an imbalance in the electrolyte in the red blood cell, chlorine ions from the plasma will have to enter into the red blood cell so that they will be balanced. Remember, bicarbonate ions and chlorine ions are negatively charged. So when the red blood cell loses bicarbonate ions, there will be an imbalance in electrolytes. So chlorine will enter back into the red blood cell. Now, in the lungs, remember that the bicarbonate is being carried in the plasma. So it will continue to carry this bicarbonate till it gets to the lungs. The hemoglobin will keep being bound to hydrogen ions till it gets to the lung. Now, when it gets to the lungs, the hemoglobin will free that hydrogen ion. The hemoglobin will release those hydrogen ions. When hemoglobin releases those hydrogen ions, you can see it in this video. This is the lung. Hemoglobin has released hydrogen ion, and oxygen, which is in the lung, has become bound to hemoglobin, which means that hemoglobin has become oxyhemoglobin. That hydrogen that has been released by hemoglobin is going to bind with bicarbonate. Remember, the bicarbonate was carried in the plasma. That bicarbonate that was carried in the plasma enters back into the red blood cells, binds with hemoglobin, and forms carbonic acid. That carbonic acid would then dissociate to form water and carbon dioxide. This carbon dioxide is what is excreted as waste products when you exhale, and water would also be excreted as water vapor. So that way that the body has removed that acidity from the body system. What happens in the lungs is how the respiratory system compensates for acidity. This happens 30 minutes to 60 minutes later. First, remember, there is a buffering system by hemoglobin. Second, remember, there is an exhalation of carbon dioxide in the lungs as a way of reducing that acidity. Remember that when carbon dioxide is exhaled, it intends that the pH will go back to normal, because carbon dioxide, one of the reasons for the acidity of the body is carbon dioxide. So when you exhale carbon dioxide, you are invariably decreasing the number of bicarbon of hydrogen ions in the blood, and also normalizing your pH. Now, this situation also means that when somebody is having a metabolic acidosis, there will be increased ventilation as a compensatory mechanism, because the body's central or neural system would go and inform the lungs, exhale more carbon dioxide so that the acidity will be removed. It's just like somebody who has maybe used a perfume to spray in a room, a very deadly kind of perfume. What will you do? You open the windows, you open the doors, you are telling it, let this perfume go, let this toxic substance leave. That's exactly what the body does. The body tries to make this acidic product to leave in form of carbon dioxide. Tells the lungs, breathe faster, so that this carbon dioxide would leave us, this acidic product would leave us, and we will come back to normal. This, remember, occurs 30 to 60 minutes later. But then we'll talk about the baba of them all, which is the renal system. But we will not discuss it in this video. We will discuss it in our next video, because I want you to calm down, take a cup of tea, and understand this. If this video was any help to you, please like, subscribe, share with your friends. I'm your friend Diala Samuel, and I'm here to help you understand medicine better. Thank you.